Welcome to the Dermatology podcast from the Dermatology Education Foundation. We're here at Derm 2025 in the exhibit hall right outside of the general session where the incredible education is going on. And I'm here with DEF Advisory Council member and Derm faculty member, Alexa Hetzel. Alexa, why don't you tell everyone a little bit about yourself?
Hi, everybody. Like Paul said, my name is Alexa Hetzel. I'm a physician assistant. I've been in dermatology for just over 12 years. I practice in East Windsor, New Jersey for Schweiger Dermatology.
Excellent. So among the presentations that you did, you were part of the Career Development CME Symposium last night. Talk to us a little bit about why you wanted to be a part of that program. Why is career development so important?
Well, I found that even in my own career development, there were so many people that I met and I could rely on to help get me where I needed to get. And I didn't realize there were things I didn't know until all of a sudden I didn't know them. And so there's so many small little tweaks that we can make that makes ourselves more professional, makes us look better overall in terms of what we've done in our CVs and things like that. That definitely gives us the best foot forward, not only if we're trying to negotiate our contracts within our practice or switch practices or even do things like product theaters or speaking or advisory boards. I think it's important for us to be setting the best foot forward. And so I always want to pay that forward because I had help doing it. And so I want to help others reach that level as well.
Awesome. So one of the things you talked about is the fact that you've been involved in a lot of research. Mm-hmm. So obviously that goes hand in hand with clinical care, but it's not necessarily something that everyone does.
Yeah.
Why did that interest you and how did you get involved and be able to really develop that part of your career?
Yeah, so I mentioned that I worked for Schweiger Dermatology, but 2.5 years ago it was Windsor Dermatology. And so I've always practiced at Windsor Dermatology. And even before I became a physician assistant, I actually was a clinical research coordinator and a medical assistant at that office. So I was getting my hours for PA school. They kind of like introduced me to it. And my very first study was ixekizumab, phase 3. So I fell in love with psoriasis and research from the get-go. And then as I realized there were so many ways that we could help so many people that were underserved or didn't have access to therapies or help develop new drugs that could help the masses. And then when we became Schweiger, my bubble was burst a little bit because my blinders were taken off that this is something that everybody does. And I realized that this is something that nobody does. It's really such a very niche thing for really hospital-based medicine. And so to be able to do that in private practice, it just becomes such a passion of mine.
Excellent. Okay. And you just touched on something in the fact that your practice has changed a little bit.
Yeah.
You are in a larger practice. You mentioned some of the benefits of that. But sometimes we don't always think about the fact that, yes, patient care, these amazing new drugs, it's so important to what dermatology MPs and PAs do. But the patients need to get the drugs. You're managing a staff. You are not just seeing patients, you are kind of managing a care team. Can you talk a little bit about some of those skills and how folks can really develop them to get the best outcomes for their patients?
Yeah, I will say I'm not very rigid except for when it comes to care of my patients. And so it starts when patients walk in the door. The front desk. My front desk is incredible. They know what I want. They know what to expect. They usually have a good idea of the pulse of things, but they'll come back and ask. And there's so much communication just from as soon as they walk in the door. But that's the patient's first experience. And then we move on to my medical staff. Same thing. They know the things that I'm looking for in terms of how long have they been here? Have they been here before? How long has this rash or this acne been there? Like the questions that I want them to ask, they know. And there's open communication with that. Is it okay if they don't get everything right? Of course, because I'm one of one. I'm in my own head. And so I don't expect them to read my mind, only occasionally. And then it comes down to me. So ultimately making sure that everybody is communicating and everybody is happy. If my staff is also unhappy, then they're not going to do the prior authorizations and help me with those to get the patients the medications. They're not going to help me make phone calls for biopsy results and blood work. They're not going to help me with all of those little extra things that we have to do to make this seem like a seamless experience. And so we're very much a family because we spend so much time together, but it is really important to make sure that you say what you want, but don't be mean about it. Because if you're mean about it, you're not going to get anywhere.
One of the topics that came up last night was the merit-based incentive payment systems, or MIPS. And you had, tying this back to staff, you talked about kind of a direct way that you kind of deal with MIPS in your practice. Can you tell us a little bit about that?
Yeah, so I looked up the measures for MIPS this year because they do change occasionally, not much, but they do change. And so I wrote them out and I printed them out for everybody. They have a little square of what the MIPS measures we have to achieve if we can achieve them within each patient. And so they know what questions to ask, whether it's smoking cessation or if they are a current smoker, whether it's what's their itch score for a new rash that they're coming in, so we can document that and reevaluate it at their next visit. Or their psoriasis, if they are on a biologic, did they have their TB within the last 6 months? So there's a lot of questions that they're prepped to ask. And melanoma recalls, those are equally as important. So that way we are hopefully satisfying all of our MIPS measures.
And these are sort of natural things. You're going to want to know most of
Yeah.
these things anyway, so it does make a lot of sense.
Exactly.
Okay. Another thing you talked about last night is the CV. It's something people kind of take for granted. People might assume they know what their CV should look like, but it can be deceptive, right? Tell us a little bit about that.
So I think even for myself, just starting off through this whole journey over the last 12 years, I thought CV and resume were the same, and they're not. And that's not a wrong thing. Nobody had taught me, and I eventually learned that a resume is definitely not a CV. And so then also developing my CV, in the beginning it started off very rough because there wasn't a lot for me to add and I didn't know how to really organize it and put it together. But I think that's where a lot of our mentorship comes into, meeting other PAs and NPs in the field. Speaking to your pharmaceutical advisors, your thought leader liaisons can help guide you in terms of how to make your CV look the best that it can look.
Excellent. And for someone who is interested in doing more, especially some beyond patient care, what are some of the tips you have talking to industry liaisons and things like that? But how can they do that, especially if maybe they're not as familiar, maybe they're a little timid?
I think talk to everybody. Talk to everybody that you can. You're going to learn good things from people and you're going to learn bad things from people, but you're going to learn something from someone. And so having those conversations and relationships with your reps, if there's a drug that you like and you want to learn more on, speak to your MSL. Develop those relationships further. And then once you understand the science and you're like, I really like this product, I've done it before where I've said something to one of our reps and I was like, I want to be a speaker for you guys. I really like your product. I'd really like to promote it. And they're like, okay, well, let's push that up. And that's how I became a speaker. And so if you don't ask, the answer is always no. And so continuing to advocate for yourself and just ask the questions are so helpful because you might not be a speaker right off the gate, but you could do an advisory board. And then the more advisory boards that you do, then maybe you'll be a little bit more likely selected as a speaker, something like that. So it's baby steps. It doesn't happen overnight. It's been a process and I'm still, I feel like, developing myself. And that's good because we're always ever evolving and ever changing. We don't want to be stagnant, but it doesn't happen overnight.
I think that's really important. Speak up. It kind of comes down to just putting yourself out there, right?
Yeah, ask. It's always no unless you ask.
Perfect. All right. And then another thing you talked about were some of your favorite resources. You were speaking with Matt Bruno about that. Are there any resources that you think are really essential or that you don't think people really know are out there that they really should?
Yeah, so one thing I didn't get to talk about was the programs that a lot of the pharmaceutical companies do have. So like Sun and J&J both offer book programs, as well as Sanofi actually. So if you haven't gotten a book from one of your reps, ask them about their book program. You can select a book and they'll ship it to you. I love that feature because I like tangible things. I like to flip through pages and highlight stuff and write things in the margins. So I'm a book person, so I think those things are invaluable. And if we can get them for free, those books are so expensive. I use a lot of UpToDate. I think that's a great resource that I have just become familiar with. I can track also CMEs when I use it, so that's also nice when I'm looking at my continuing education credits. And there's this new app that I found called Open Evidence, and it's a HIPAA compliant app, but when you're looking in things, it's not just AI, it's not Chat GPT where they're gonna spit out whatever they think they want. It might not be accurate, but it actually is based on real life articles within JAD or different publications like that. So it'll spit out a real answer that is science-based.
Excellent. That sounds fantastic.
Yeah, it's exciting.
So kind of pulling it all together, what would be your your key piece of advice as a mentor to younger NPs or PAs kind of just getting started in this field?
My biggest thing is know the field. So know your conditions, know why they're happening, why medications work for them. Know those mechanisms of actions. It's a lot of back end, but it'll make it so much easier as we continue to get new medications to understand why they work differently, or why they may work more effectively, or why there may be side effects that start to develop. And that baseline is so invaluable. It'll just help you progress further in your career. I would say talk to as many people as you can talk to. Learn from as many people as you can learn from. Like I mentioned, there's good and bad to learn from everybody. And you can take the bad stuff and you can not implement that. And you can learn to avoid those things. And you can take the good and you can emanate those things. So there is always something to learn from everybody. And then burst your bubble a little bit. Get outside of your comfort zone and talk to people and figure out what else is out there, because there are so many things that we can do as PAs and NPs in dermatology, and all you have to do is ask the questions.
Excellent. I think that's perfect advice. Thank you so much for sharing that, and thank you for joining us for the Dermalorian podcast from the Dermatology Education Foundation.